Hi, Dr. Karin Drummond, owner of Drummond Chiropractic, and I'm going to share with you how to use a TENS unit. What is a TENS unit? A TENS unit is a transcutaneous electrical nerve stimulation, and it works to block nerve conduction. It's kind of like a nerve block, but it doesn't go very deep, so it's super safe. But before I get into how to use it, let's talk about some contraindications. One, always talk to your healthcare provider to make sure a TENS unit is appropriate for your specific case. But in general, we never put it on our eyes. We don't put it on the front of your neck because that can cause a vasovagal response. Never through the chest, meaning front and back. Not if you have a pacemaker. Don't use it internally. There are TENS units that are specifically designed for the jaw or tooth pain, but it's a very different unit than the one I am showing. Don't put it on open wounds, infection, tumor, cancer, because there's been some studies that it can increase cell growth, and that's good on damaged tissue, but obviously not on cancer. Epilepsy, because it is an electrical stimulation. Areas of numbness, because if it's numb, how can you tell if it's strong enough or too strong? And it's advised not to use it if you're pregnant unless you're actually in labor, because it can actually help with labor pains. The reason why I'm sharing with you how to use a TENS unit is because I prefer it over the use of pain pills or NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs because they have some serious health consequences, especially if you use it past the recommended time. I've known people that claim to have been taking pain pills for months, and that's not what those pain pills are designed for. They're designed to help you through in a very short acute period, not for chronic pain. The side effects of taking pain pills or NSAIDs are things like stroke, increase in your blood pressure, heart attack, kidney damage, even increase in symptoms of asthma and blood clots. So can you see now why I'd rather you use a TENS unit that is really, really super safe? So let's talk about how to put the settings for the TENS unit. To get access to the TENS unit, you open up the TENS and you'll see these dials here. On the top, it says mode, B, N, M. It has B for burst, N for normal, which is constant, and M, which is modulating, meaning it's moving around. And the reason why they have these different settings is, have you ever noticed when you put clothes on, you first notice the socks that you put on and then your pants and your shirt, but within seconds, you hardly even feel your clothes anymore, it's just your new normal? Well, same with the TENS unit. If it's always the same, your body's going to acclimate to it, and it's not going to work as well at numbing or stopping your pain. So for acute pain, I find if you're just going to use it for 15 minutes, you can keep it on the N for the normal, the constant. But if you're using it for much longer than that, I highly recommend using the M mode because it'll move around in there. If it's acute, you want to crank both these dials, and for my TENS unit, all the way clockwise. These are the highest numbers it has, and that way you're really bursting those nerves with electrical stimulation. And the rate is so short because the more bursts per second means the waves are shorter. It won't give the muscles an opportunity to contract, so you'll influence more the nerves than the muscles. Again, the time at 15 minutes, I like to set it, there's another dial here that has 15 minutes, so after that it automatically turns off. As for the time, I like setting it so it automatically turns off at 15 minutes. That way, in 15 minutes time, you can determine if it's worth turning it back on. And you can do that up to 30 minutes, 45 minutes, 60 minutes. But after 60 minutes, just give it a break. Your body's probably acclimating to it anyway. You could do it 4 times a day. You could even do it, you really could do it as many times of the day you want, but you're just gonna eat away your battery. So I find 4 times a day is plenty for that acute pain. You just wanna stop the cycle of pain. For chronic pain, I find putting it on burst, so moving the top dial all the way to the left on my unit, because that gives it a little shot of electricity. And that way, because with chronic pain, it's that constant achy pain. So you want to kind of shock it so it kind of turns off. Another option is the modulating pain. That way it's moving around. Another way to not acclimate to this electrical stimulation. If you're going to do the burst mode, I find doing it the high numbers again, maybe not crank it all the way like you would with the acute pain, just crank it up to where you notice it's helping your pain. But another way you could do it is put it on modulating, so you can put the top dial all the way to the right and put the width at 150, so you crank that back a little bit but you put it so the rate is real slow, like all the way down to 10. That way, when it's moving around, it's kind of not really overstimulating anything, and it might even make the muscles contract a little bit. The reason why I like that setting is because as electricity moves around and at this wider width of a wave and at a slower rate, you might actually get the muscles to contract, and the nerves are just slightly stimulated, and that way your body releases its own endorphins and you get the pain relief from your own endorphins. This one you got to do a good 15 minutes and then just give it a break, because I would rather you do a bunch of short treatments many times a day, at least 5 times a day, because the idea with chronic pain is to break the cycle of pain. So for muscle spasm, you could do constant or make it moving around. You want the width to be pretty strong, all the way cranked over to the right. But for the rate, we want to slow it down so that it's longer, so that the muscles have a chance to contract. Because the problem with muscle contraction is it's stuck. So if you get it to squeeze a little harder, when it lets go, it might actually relax the muscle. Again, 15 minutes should be plenty of time to do that. If it feels better after a couple minutes, stop after a couple minutes. But I wouldn't do it much more than 15 minutes. If it's not working at that point, maybe finding a different modality for you. Headaches is an interesting setting. I find that for headaches, I crank the right dial all the way down first, and then the second dial up to the middle. And the reason why I think this works is we don't want to irritate the nerves. It's really close to the head, so you don't want it too intense. And we want the rate a little slower because a lot of headaches come from muscle tension, and it works really good for migraines too. You can crank the first dial up a little bit to 80 if you need it, but I find 30 and 50 works for most people. As for the time, 15 minutes is generally enough time, but if you need more, you can go up to 60 minutes. But again, I wouldn't do much more than an hour, because if it's not working at that point, I think a different modality would be warranted. So now I'm going to show you how to put the placement of the pads for neck pain. You take the 2 pads from one of the leads. You can tell they're connected because they're on the same one wire. These 2 are on the other wire. It doesn't matter how you start. I'm going to put the black one on top and the red one across and on the bottom of the point of pain. So this is her neck, it's in pain. We've gone above and below the point of pain. One thing that a lot of other sites don't mention is that you always want to make sure the pads are at least a pad width apart. So the smaller the pads, the closer they can be. The bigger the pads, the farther apart they need to be. So I'm going to take the other black one and put it beside the first black one. And then I'm going to take the other red one and put it across from the first red one. So we have 2 red ones and 2 black ones, like so. And that will surround the pain. And then you turn the TENS unit on. And how you turn it on is you open up the lid that controls the dials of the intensity. You click one on by turning it clockwise. You can see the lights turning on, and then you turn the other one. And you keep incrementally turning it until it gets to the point where you feel it and it's relieving your pain. To turn it off, you turn it counterclockwise on each side. Now I'm going to show you how to put the pads on for shoulder pain. Take these 2 pads that are on the same lead. You put one of them behind the shoulder in the meaty part. You don't want to be on a bone. That'll make it more uncomfortable. Loosen your shirt a little bit. Right there. So I put it right there. You take the same lead opposite pad and you're going to put it in the meaty part of the front of the shoulder. Like so. And again, make sure you're on a meaty part, not on the bone, or not right on the joint. And again, you want the pads to be at least a pad width apart, which they are. Then you take the other 2 pads, you put one in the front, on the meaty part of the pec, not on the front of the neck, and not on the front of the chest. You want to be really close to the shoulder for the front one. And then for the last one, you put it behind the arm, up high, close to the shoulder. So again, we're a pad apart, and a pad apart this way. So we're doing a cross pattern so we can really surround that shoulder. So now I'm going to show you how to put the pad placement for low back pain. If the pain is higher in the low back, you want to make sure you're above and below where that pain is. If it's in the low part of the low back, you want to be above and below that point. So I'm going to say the pain is right there. So you start with the first pad above and to the right, and then you take the second pad of the same lead below and to the left. Then you take the other two and you place one above and the other one across. And the way they have this color coded, you can see the red's on one side and the black is on the other side. Just remember that you want the same lead to be cross pattern from each other. And above and below, left and right to the point of pain. Now I'm going to show you how to put the pad placements for knee pain. You put one pad above the knee on the inside, one pad below the knee on the opposite side from the same lead. Take the other lead pads, put one above the knee and one across on the opposite side. You've got your cross pattern, you're surrounding that knee. That's how you put the pad placement for the knee pain. A tip to help prolong the use of the adhesive is when you're done with the pad, put it on the little plastic piece it came with and store it in the refrigerator. You'll get a lot more uses per pad if you use that little trick. To extend the life of your TENS unit, store it with the battery out of the TENS unit. The TENS unit comes with a clip that you can put on your clothes so you can wear it throughout the day and only turn it on as you need it. And the wires oftentimes you can hide underneath your clothes. No one has to know that you're even using the TENS unit. Again, if you're going to use a TENS unit, make sure you talk to your healthcare provider, make sure it's appropriate for you, make sure you have the settings that's best for your condition, and hopefully it helps you with your pain.